Doctors in South Africa say Omicron is weaker than Delta. Unben Pillay sees scores of sick people every day as the Omicron strain sweeps South Africa. But he hasn't had to admit anybody. That's why he and other physicians think the Omicron variant is causing milder COVID-19 than the Delta, although spreading quicker. They can control the illness at home, Pillay added. Most recovered after 10 to 14 days of isolation, Pillay stated. That includes elderly individuals and those with health issues that make them more susceptible to coronavirus infection, he added. Since the initial report of Omicron in southern Africa, numerous physicians have shared similar accounts. While they stress that additional data will be needed to be certain, their findings and early evidence provide some suggestions. Meanwhile, researchers worldwide are tracking cases and hospitalizations, and evaluating existing vaccinations and therapies. Aside from South Africa, Omicron instances are now being reported in dozens more nations. Pillay works in Gauteng, where the Omicron variant has taken root. It has 16 million citizens and includes Johannesburg and Pretoria. Gauteng experienced a 400% increase in new cases in the first week of December, with Omicron testing accounting for over 90% of them. In the final Delta wave, Pillay's COVID-19 patients, apnea and low oxygen, many required days in hospital, stated his patients now have flu-like symptoms including body pains and coughing, he added. Pillay is a director of an organization representing 5,000 general practitioners in South Africa. Netcare, the biggest private healthcare provider, reports milder COVID-19 instances. But the instances are increasing. Last week, South Africa reported 22,400 new cases, up from approximately 200 each day. The latest wave has infected 90,000 individuals in a month, said Health Minister Joe Fowler. 86% of the current wave's patients weren't coronavirus vaccinated, Jasat added. COVID patients in South African hospitals are also younger than in previous pandemics, with almost two-thirds under 40. Despite early indicators that Omicron cases are less severe, Jasat warns that the amount of new COVID-19 cases may overload South African hospitals, leading to more severe symptoms and mortality.